A robotic-assisted surgery is a surgery that's done laparoscopically with robotic assistance. So we use instruments that are similar to your typical laparoscopic instruments, which are smaller and go through ports inside the body. But what we do is we attach these instruments to a robot, and then the surgeon controls through the robot those instruments at a console. And so basically anything that you're doing with that you can do with your hands, you can do with those robotic instruments.
With the Da Vinci system and the robotically assisted procedures that we perform now, we can actually do cases that are much more complicated than we could do laparoscopically previously. Many of these patients we would open. We would never even consider doing this laparoscopically.
In the course of my practice, I've seen that the Da Vinci robot has allowed us to do the same procedures that we did open in a much more refined method with the same, if not better, outcomes and a lot less impact on the patient.
The benefit is that all of the instruments are held perfectly still. We have better visualization and the ability to essentially have a wrist inside of the abdomen. So, in laparoscopic surgery, we have these straight instruments that can open and close, but that's about it.
Using the robot, it allows me to have 3D visualization, precise control. I've got tools that can move as if they were my own wrists that will allow me to see better, to perform better, to be more stable, and to have decreased risks.
The part I've been impressed with is the majority of my patients have left the hospital the following morning with a pain score of 2 or less. In light of the minimally invasive options we have, we can get the patients back to their families, back to work, back home much more quickly. I really think that's the important part, is patients benefit, they move ahead, and they're back on their feet quickly.